So at first, I would like to thank all of you for joining today's in our seminar. Now I will start my presentation. The title of our presentation is Poultry Health and Welfare in Developing Countries. Now, at first, I would like to introduce myself. I am Dr. Abdullah Al-Maruf, DBM MS. I also completed my diploma degree in poultry research. Now I am in PhD fellow in Department of Medicine, Bangladesh Agricultural University, Mymensingh. So thank you. Let's focus. Now, at first, what is animal welfare? Animal welfare is defined as providing animals with environmental and management to meet their essential physiological and behavioral needs. So, what is poultry welfare? Poultry welfare means that the basic needs of the birds are being met on, on a day-to-day basis. These needs basically are food and water in case of poultry. Now, who is responsible for health and welfare in case of poultry? Three main parties are involved. At first, the owner, individual or multiple parties, includes the farm manager or operator of the factory or of the farm. Secondly, for the veterinarian, that the person we are, additional healthcare and disease prevention workers. And thirdly, the government or professional association or organization. It actually indicates a large community which includes a state or a country or a poultry association, farm bureau federation, national poultry implementation plans. Example: United States Poultry and Egg Association and National Chicken Association. Now, what are the main animal welfare for poultry perspective? We identify five basic needs for poultry welfare. This includes food and water, freedom to move, stand and turn around, stretch, sit and lie down. Birds can see each other, that is visual contact, shading or housing, prevention of disease, injury and voice. I think these five are the main basic needs for poultry welfare in case of large or small poultry farms throughout the developing countries. Now, when poultry welfare practice starts, it starts from hatchery and then up to the consumption of the poultry. In case of hatchery practices, which includes incubation period of the day-old chicks, hatcheries hygienes, hatchery equipments and procedure, handling method, surface of flooring, equipments, setup and machineries, ventilations, holding time and dispatch for transport. In case of farm practices includes housing or shelter, feeding and drinking equipments, temperature or ventilations, handling and procedures by farm staff, and finally biosecurity and health status. Other some issues for the welfare of poultry are sampling. When sampling practices to optimize poultry welfare, methods of sampling birds within the flock, handling of birds for sample collection. Other issues for poultry welfare are during culling, euthanasia, handling and transport, lighting reduction, withdrawal of food and water, transportation, loading and unloading during marketing, culling and euthanasia during catching. Now, what is the animal cruelty that what are talking about? Animal cruelty is defined as instance where the animal are at a glance when animal are cruelty means when animal or birds are cannot performing their works or when they cannot get their basic needs during their lifespan. In here, I set up some examples of cruelty in poultry. That some examples are beaten by another birds, kicked or killed, wounded, multi-talent, maimed, abused, and some other example I show in my presentation. And this is also some procedure or technique used for birds welfare. These are includes molting, birds density, and these criteria must be maintained when a profitable or a beneficiary poultry farm is maintained during their poultry industry. Among them, biosecurity is most important. Ventilation, housing, availability of quality food and water, bird density, and spacing, etc. Now, there are ultimate sum effect, which is positive or negative effects. Uh, in case of disease or other unbearable condition that causes negative effects, when we can provide some good environment during the poultry farm, it causes positive effect and which must be confirmed by veterinarians, farmers, and urban public people. I will make clear now. I will discuss about some important poultry diseases. You know there are a lot of diseases occurring in poultry rearing. This includes viral diseases, bacterial diseases, fungal diseases, and other some important diseases, which causes high economic losses in the poultry farming uh, by by medicine or by interviewing with the doctors. Now, some viral diseases, which is very important in developing countries, this includes avian influenza. By avian influenza, it causes a great economic loss during the poultry farming in Bangladesh, and which causes huge economic losses in our country. And that Newcastle disease, infectious bursal disease, which is also called the AIDS of the poultry, infectious bronchitis, fowl pox, Marek's diseases, infectious laryngotracheitis, avian encephalomyelitis. Now, some important bacterial diseases include cholera disease, polybacillosis, fowl cholera, infectious coryza, cholestatrial disease, avian tuberculosis, streptococcosis, staphylococcosis, pseudomonas. Fungal disease includes aspergillosis, candidiasis, mycotoxicosis, coccidiasis, cryptosporidiasis, and histoplasmosis. Some other non-infectious diseases include Internal parasites, that means cystid, nematode, and protozoa. External parasite includes lice, mite, nymphs, pest, beetles, lice, etc. These diseases of the musculoskeletal system, arthritis, osteoporosis, amyloidosis, streptoporosis, rickets, osteomalacia, chondrodystrophy, etc. Cardiovascular disease includes dilated cardiopathy or arteriosclerosis. Nutritional diseases such as vitamin A deficiency, thiamine deficiency, calcium and phosphorus deficiency, magnesium, potassium, and zinc deficiency. Environmental and pathological disorders, which includes ammonia gas problem and traumatic problem during the poultry rearing. Now I will discuss you important viral diseases called Newcastle diseases, which causes high economic loss in Bangladesh during the poultry farming. Newcastle diseases are caused by paramyxovirus. Only one type of serotype is known. This is also called antivirus, which has mild strain, lentogenic, medium strain, mesogenic, and virulent strain, halogenic. The strain used for live vaccine are mainly lentogenic. How the disease is transmitted from flock to flock or poultry to poultry. Mainly transmission occurs through infected droppings, respiratory discharge between the birds, infected equipments through trucks, personnels, wild birds or air. The incubation period is available but usually 3 to 6 days. Species affected and chicken main target of this virus is chicken and duck. Now, what is the clinical sign of Newcastle disease? The disease causes high mortality with depression and death in 3 to 5 days as a major sign. Affected chicken do not always exhibit respiratory or nervous sign. Mesogenic strain cause typical sign of respiratory distress, paralysis of listed, which is called torticollis. Egg production will decrease 3 to 50% or more. May have thin shell eggs without shell without shells may also be found. And internal lesion causes inflamed tracheas, pneumonia in the ear sac are the main lesions. Hemorrhagic lesions are observed in the junction of proventriculus and in the intestine. Oh, sorry. This is the some pictures with pictures and some clinical lesions caused by Newcastle disease. This this is the torticollis lesion, which is found and and this is the hemorrhage in the junction of proventriculus, which is very much specific in case of ND. And this is the hemorrhage in the trachea, and this is the lesion of the hemorrhage in the proventriculus. And this is the hemorrhage in the ceca, and this is the gross lesion. Now, how you will diagnose this disease? It is better to isolate the organism from the trachea or coetal swab. Infectious bronchitis and infectious laryngotracheitis can also be can also providing the same lesions into the food. And I would like to say you that 3 system will This system is affected by the Newcastle disease. One is the nervous system, the main nervous system, digestive system, and the respiratory system. Three system will be affected by Newcastle disease. In nervous side is mostly the paralysis. The poultry will be paralyzed, and in nervous system, in respiratory system, it causes respiratory distress, which is a major sign in case of ND. And in case of digestive system, it causes diarrhea, but whitey diarrhea. So by the diarrhea, a bird loses its internal balance, internal fluid balance, and in respiratory distress, it causes respiratory problem, and in nervous system affected by the virus causes paralysis. So you can understand how dangerous this virus is work for poultry. Now the treatment and control. As this is a viral disease, actually there are no treatment. Only some supportive treatment can be provided by some antibiotics such as gentamicin, chloramphenicol, colistin, and uh, some other antibiotics can be used with saline solution, and some respiratory stimulant can be used for the treatment in this case, but only the supportive treatment, no specific treatment. And vaccination against Newcastle disease with live inactivated adjuvant vaccine are used in this case. In Bangladesh, we usually use BCRDB vaccine during their 4 or 5 days of their birth, and booster will be given in every 6 months. Now I will talk about with an important bacterial disease, which is known as Pulluram disease or Salmonella disease. What is the Pulluram disease? Pulluram disease is caused by Salmonella enterica pulluram, and it is characterized by high mortality in young chicks and turkeys. Affected bird flock near the heat source are anaerotic, weak, depressed, and have white fecal materials passed to their vent area. In addition, the birds are respiratory disease, blindness, or swollen joints. Now, the procedure of transmission of the salmonellosis, that is vertical transmission. Verticals means mother to dam transmission. This is occurs mainly by their trans ovarian transmission or by their eggs. Direct or indirect contact with the infected birds or contaminated feed, water, or litter are transmitted via egg or hatchery contaminated usually. Transmission between the farm is due to poor biosecurity condition in the developing countries. Now the major clinical sign and lesions of this disease. There are there may be no lesion due to acute septicemia and birds found to be dead. Lesion in young birds usually include unabsorbed yolk sac and classical gray nodules in liver, spleen, lungs, heart, gizzard, and intestine. Appear in the cecal course, and raised plaques in the mucosa of the lower intestine are sometimes even. Occasionally, synovitis is prominent. Adult carrier usually have no gross lesion but may have nodular pericarditis, fibrous peritonitis, or hemorrhagic, atrophic, or regression ovarian follicles with secession contents. In mature chicken, Chronic infection produce lesion indistinguishable from those of fowl typhoid. This is the some pictorial presentation of the salmonella infected birds. These are the some cross lesions. The birds become died without showing any clinical sign, and they causes whitery diarrhea, and in case of their liver, it become pale, and this is the nodule may be found in their liver. Now the diagnosis. Actually, diagnosis is mainly by their clinical sign, postmortem examination, clinical examination, but it is better to confirm the organism by isolation, identification, and serotyping. Some serological test, can be used for this diagnosis, such as ELISA. ELISA test can be used by their can be used for diagnosis of salmonellosis, but confirmatory diagnosis needs to be performed polymerase chain reaction or PCR, and culture and PCR. Now the treatment. Actually, this is there are a lot of antibiotics, such there are a lot of medicines such as sulfonamides, and some antibiotics such as furazolidone, biomycin, gentamicin, chloramphenicol can be used for treatment of this salmonellosis. And some control measures. Treatment of the infected flock will be elevated the carrier state and never recommended. Is based on routine serological testing and breeding stock to assure freedom from infection. In addition, management and biosecurity measures should be taken to reduce their reduce the infection rate from feed, water, wild birds, rodents, insects, or people. Birds should be purchased from source free from salmonella is the main uh, criteria for control of the salmonellosis. Now I will discuss you about a fungal disease. This is called aspergillosis, or called broader pneumonia. The disease is caused by a fungus called Aspergillus fumigatus. Transmission usually occurs through inhalation of the fungus spore from contaminated litter. Example, wood shaving, contaminated feed, hatcheries maybe also contribute to infection to chicks. Species affected, usually the chicks are susceptible. Older chicks are more infection. The clinical sign: infected chicks are depressed and thirsty. Gasping and rapid breathing can be observed. Mortality is variable from 5 to 50 days. Cross lesion involve the lungs and ear sac primarily. Yellow-white pinpoint lesion can be found. Sometimes all body cavities are filled with some yellow-green granular fungus growth. Now the diagnosis. Diagnosis is usually by their clinical sign or their postmortem lesions. This is some pictorial presentation of this disease, and you can see the chicks are the problem occur in their respiratory distress, and they are uh, some problem with their that causes this type of situation. And this is their infected lungs. you see the nodules in their lung, which can be seen in naked eye after postmortem. This is the identical things that you can diagnose these aspergillosis. After postmortem, you can see this type of lungs in case of aspergillosis. The control and treatment. There are no specific treatment for aspergillosis. Affected chick should be in breeder and hatchery management is necessary. Choice of litter material is important so that no spore bearing wood shaving are used. Thanks for your patient hearing. Thank you very much. And I would invite you if you have any questions.
Thank you so much, Dr. Abdullah Al-Maruf, for your time. And we will also like to apologize all our participants for the late time, and also our network is very bad. And now it is our question and answer session. Uh, every person who have a question, I would like to raise his hand, and then we will select it by randomly. Raise your hand if you have a question.
دكتورkeena aad u mahadsan yahay presentationkana waxaan rajeynayaa inuu meesha kusoo gabagaboobay dhammaantiin aad u mahadsantihiin kasoo qaybgalayaasha waxaan rajeynayaa in lasoo gaaray qaybtii ugu dambeysay oo ah qof walba su-aasha intuu qabo micnaha inuu doctorka su-aal weydiiyo qof walbo su-aal qabo mute-ka ka baxo doctorka su-aal ha weydiiyo insha allah
Thank you, Yonis.
السلام عليكم ورحمة الله وبركاته. السلام عليكم ورحمة الله وبركاته.
وعليكم السلام.
My name is Abdullah Muhammad Ali from Somalia. I like to ask a question about our doctor. My question is Hungary operation and citation of broiler. I like that question to answer. Hungary operation and citation. Hungary operation and sanitation. Thank you very much.
So,
Next question, we would like to give Dr. Abdullah Al-Maruf for 2 or 3 questions at once. Next question, we have Mohammed Yassin. Mohammed Yassin, unmute yourself. Mohammed, your voice is not clear.
I cannot hear him.
Your voice is not clear, Mohammed.
Okay, sorry. Are you hearing me just?
Okay, go ahead.
First, Assalamu alaikum warahmatullahi wabarakatuh. Next, I would thank to our Dr. Abdullah and all the participants on the associations, Somali Society for Animal Welfare. My question is, when the doctor explained the Newcastle disease in the section of diagnosis, he tells us when, in terms of diagnosis, the clinical signs of the Newcastle disease and infectious laryngitis or infectious, it is so same. How can we diagnose as a clinically? Why? Because of in developing country, just like Somalia, we don't have labs to diagnose as a test, and we don't able. We have to be used as a clinically by our visual eyes. How can we diagnose?
Okay, go ahead, Dr. Abdullah
Thank
Al-Maruf.
you very much for this nice question. I will show you this slide. This is can you see? This is the condition which is called a torticollis condition. Can you hearing me? Can you see the birds is just looking in the sky? And this is called the torticollis condition, which is only occurred in case of this disease, Newcastle disease. And Please show these proventriculars. These you can show these proventriculars. You can when you perform postmortem of these birds. When you go to the proventriculars, you can see the hemorrhage. This is the hemorrhage. Is is this you can see the hemorrhage in the proventriculars, which can be seen in naked eye, and you can make a tentative diagnosis that it can be Newcastle disease. Okay, this you can show on my slide. This is the hemorrhages. These the hemorrhages. These the hemorrhages are found in the proventriculars and the cecum, ceca, cloacal ceca, and I think you can see in this slide. My cursor is show the cloacal ceca. This can be identical in case of NDB virus. I think you can understand. Thank you. What to read this?
Thank you so much. Now we want to give Dr. Harbi. Harbi,
Yes, please. My question is that just to bit explain biosecurity. Biosecurity is difficult one for the poultry, but if you can explain a bit about the biosecurity. Over.
Okay, thank you. Biosecurity is a large term. Actually, bio means life, and security means to secure oneself. So biosecurity means secure one's life. So biosecurity, in general, biosecurity has a large event uh, in, in, in the biosecurity, which includes a lot of words such as traffic control or human control or control of various birds, rodents, rats, of their uses of their equipments in one farm to another farm. A lot of words. It is very difficult to tell you biosecurity because it is a large uh, word to discuss with biosecurity. Uh, I think you understand.
okay, thank you, Dr. Abdullah Al-Maruf. Now we would like to end our presentation and question and answer session. Thank you, Dr. Abdullah Al-Maruf. And now you can
Thank you
go.
very much. Thank you all the participants. I think we can learn something from your presentation. Thank you very much for your question here. Assalamu alaikum.
Alaikum salam.